Welcome! In this 5-hour simulated NCLEX-RN exam video series, this is one of 5 essential videos in the series, so check the description for links to all. Grab a notebook to keep track of your performance as you go. You'll see each question on the left with answers and explanations on the right, and I'll break down why each answer is right or wrong. You can pause or rewind whenever needed, especially for case studies. Let's get you fully prepared for the exam. Mrs. Anita is a 65-year-old woman with a history of kidney disease and hypertension. She has been experiencing symptoms of fatigue, muscle weakness, and irregular heartbeat. Upon examination, it is found that Mrs. Anita's potassium levels are low at 2.8 milliequivalent per liter. What is the most likely cause of Mrs. Anita's low potassium levels? The options given to you for this question on the screen are Option A, excessive potassium intake in diet. Option B, strong physical activity and exercise. Option C, chronic kidney disease and use of certain medications such as diuretics. Option D, exposure to heat and dehydration. Take your time to go through the question and each of these options. The timer starts on top right corner of the screen, but if you need more time, you can pause the screen as well. All right, let me reveal the right answer to you. Correct answer, C. The most likely cause of Mrs. Anita's low potassium levels is chronic kidney disease and use of certain medications, such as diuretics, as these can lead to decreased potassium excretion. Excessive potassium intake in diet and strong physical activity and exercise would not typically cause low potassium levels, and exposure to heat and dehydration can cause high potassium levels rather than low. It is important to maintain proper potassium levels in the body as it helps with various bodily functions, including fluid balance and regulation of muscle contractions and electrical impulses. Chronic kidney disease and use of certain medications, such as diuretics, can lead to decreased potassium excretion and result in low potassium levels. It is important for healthcare professionals to identify and address the cause of abnormal potassium levels in order to properly treat the condition. Let us see another question for more practice. By the way, the strategies we've been talking about in this video, those approaches for tackling tricky NCLEX questions and managing the different types of questions, are actually taken straight from a resource I really recommend: the new NCLEX-RN Practice Question Bank. If you're looking for a great way to practice and apply those strategies, this book has over 700 questions that mimic the real exam format, and each one comes with detailed explanations that help you understand exactly why the correct answer is right and why the others aren't. It's a great way to reinforce the strategies we've been covering here today. This book is especially useful if you're struggling with the new next generation NCLEX format or just need a structured way to build up your confidence with daily practice. You'll find it's all about practicing smart, not just hard, and really honing your test-taking skills. So, if these strategies are helping you out, this book could be a solid next step to boost your preparation even further. Just thought I'd share that in case it's something you want to check out. You've got this. Molly is a 2-month-old infant who is brought to the pediatrician by her parents due to excessive crying, poor feeding, and frequent vomiting. The pediatrician suspects that Molly may be suffering from gastroesophageal reflux disease. The pediatrician explains to Molly's parents that GERD occurs when the stomach contents flow back into the esophagus or mouth and cause discomfort or pain. The pediatrician provides information about the signs and symptoms of GERD, as well as the interventions and positioning strategies to manage it. Which of the following is a symptom of GERD? Let's see the options. A. Weight gain. B. Heartburn. C. Normal breathing sounds. D. No regurgitation. E. No coughing after feeding. Let's take some time to guess the answers. V. Heartburn. Option B is correct because heartburn is a common symptom of GERD. Options A, C, D, and E are incorrect because they are not symptoms of GERD. Poor weight gain, abnormal breathing sounds, regurgitation, and coughing are all potential symptoms of GERD. Let's see another question. Which of the following interventions are appropriate for managing GERD in infants? The good options are A. Assess for signs of dehydration. B. Provide small, frequent feedings with predigested formula. C. Place the infant in the prone position during sleep. D. Feed solids first, followed by liquids. E. Avoid feeding the child fatty foods, chocolate, tomato products, carbonated liquids, fruit juices, citrus products, and spicy foods. I'll give you some time to think about the answer. Options A and B are correct because assessing for signs of dehydration and providing small, frequent feedings with predigested formula are appropriate interventions for managing GERD in infants. Options C, D, and E are incorrect because placing the infant in the prone position during sleep, feeding solids first followed by liquids, and avoiding certain foods are not appropriate interventions for managing GERD in infants. The infant should be placed in the supine position during sleep, with the head of the bed elevated, and the parents should be instructed to avoid certain foods if the infant is older than 1 year. Next question. A pediatric nurse is reviewing information regarding hepatitis in children. Which of the following statements about hepatitis is correct? Let's see the options. A. Hepatitis is a chronic condition caused by a virus, a medication reaction, or another disease process. B. Hepatitis has the highest incidence among preschool or school-age children younger than 15 years. C. Hepatitis B is primarily transmitted through contaminated food or water. D. Hepatitis C is a rare condition that primarily affects adults. I'll give you some time to think about the answer. The correct answer is B. Hepatitis has the highest incidence among preschool or school-aged children younger than 15 years. Option A is incorrect because hepatitis can be acute or chronic and may be caused by a virus, medication reaction, or another disease process. Option C is incorrect because hepatitis B is primarily transmitted through perinatal transmission or exposure to infected blood or body fluids, such as during unprotected sexual contact, sharing needles, or accidental needle sticks. Option D is incorrect because hepatitis C primarily affects adults, but some children may be asymptomatic and develop chronic liver disease, cirrhosis, or hepatocellular carcinoma. In the case study, the nurse is reviewing information about hepatitis in children. Hepatitis is an acute or chronic inflammation of the liver that can be caused by a virus, medication reaction, or another disease process. There are several types of hepatitis, including hepatitis A, B, C, D, and E, each with different transmission modes, symptoms, and treatments. Hepatitis A is primarily transmitted through the fecal-oral route and has the highest incidence among preschool or school-aged children younger than 15 years. The symptoms of hepatitis A can range from mild nausea, vomiting, and diarrhea to severe liver inflammation, but many infected children are asymptomatic and can still spread the virus to others. Hepatitis B is primarily transmitted through perinatal transmission, exposure to infected blood or body fluids, such as during unprotected sexual contact, sharing needles, or accidental needle sticks. The severity of the infection can vary from no liver disease to fulminant or chronic active disease, and some infected children may become carriers and develop cirrhosis or hepatocellular carcinoma in adulthood. Hepatitis C is primarily transmitted through the parenteral route, such as sharing needles or receiving contaminated blood transfusions. Some children may be asymptomatic and develop chronic liver disease, cirrhosis, or hepatocellular carcinoma, which can be challenging to treat. Hepatitis D is a rare form of the disease that occurs in children already infected with hepatitis B. It tends to be more severe than hepatitis B and can lead to cirrhosis. Hepatitis E is uncommon in children and is not a chronic condition. It does not cause chronic liver disease or a carrier state. Prevention and treatment of hepatitis include immunoglobulin for pre-exposure prophylaxis, vaccines for hepatitis A and B, and standard precautions to prevent the spread of the virus. Hey, I just wanted to quickly share something with you that I think could make all the difference as you prepare for the NCLEX-RN. I know how stressful it can be, especially when you're balancing everything: clinical hours, coursework, life, and trying to carve out time to study. Trust me, I've been there. That's why I highly recommend checking out the 4 weeks to NCLEX-RN Questions and Answers Practice Guide. It's a take-in for preparation of this video. What's awesome about this guide is how it's designed specifically for busy students like you. It breaks everything down into manageable weekly goals, so you're not overwhelmed and you know exactly what to focus on each week. The structure is simple but really effective. Week 1 sets you up with foundational strategies and helps you get comfortable with the question formats. Week 2 digs into the core nursing concepts, things like patient safety, prioritization, and critical care. Week 3 covers pharmacology and body systems, which we all know can feel like a huge challenge. Then, Week 4 is all about practice realistic exam simulations and reviews that really help you gauge where you stand. What I love most about this guide is that it doesn't just focus on the right answers. It's all about understanding why the correct answers are right and why the others aren't. It really teaches you to think critically, which is such a huge part of the NCLEX. If you're looking for something to help you stay on track without adding more stress, this guide is worth checking out. I really think it could make your prep a lot smoother and, most importantly, help you feel more ready. Good luck. You've got this. Let's see a case study. Please go through the history and nurse notes. Mrs. Margaret Thompson, 80, was admitted with weakness, shortness of breath, and confusion. She has hypertension, type 2 diabetes, and osteoarthritis. She appeared fatigued and disoriented with cognitive decline noted by her daughter. The vital signs are given over here. The medications given are metformin, which is 1,000 twice daily for diabetes. The side effects are GI upset, rare lactic acidosis. Lisinopril, which is 10 milligrams daily for hypertension. Side effects: cough, hypotension. Ibuprofen 200 milligrams every 6 hours as needed for arthritis pain. Side effects are GI bleeding, renal impairment. The lab report is given here for elevated fasting glucose, and HbA1c indicating poorly controlled diabetes. Elevated BUN and serum creatinine, suggesting renal impairment. Elevated CRP indicating inflammation. Let's see the question. What is a potential concern in managing pain for older adults with arthritis, especially those with hypertension? The given options are A. Increased risk of cognitive decline. B. Adverse effects on renal function. C. Improved cardiovascular health. D. Enhanced joint mobility. I'll give you some time to think about the answer. Correct answer is B, or adverse effects on renal function. Arthritis pain management often involves nonsteroidal anti-inflammatory drugs, NSAIDs, which may pose a risk to renal function, especially in older adults with hypertension. NSAIDs can lead to fluid retention and increased blood pressure, potentially exacerbating hypertension and causing renal impairment. The incorrect options are A. Increased risk of cognitive decline. While chronic pain may impact cognitive function, the primary concern with arthritis pain management in this case is related to renal function due to the use of NSAIDs. C. Improved cardiovascular health. Pain management strategies may impact cardiovascular health indirectly, but the primary focus is on potential adverse effects on renal function, not cardiovascular improvement. D. Enhanced joint mobility. While the goal of arthritis management is to improve joint mobility, the question specifically addresses concerns related to hypertension and pain management. The use of NSAIDs and their potential impact on renal function is the primary concern in this context. Fill in the blank choice question. The patient with a history of hypertension and arthritis is prescribed and you are given a test to manage joint pain. Considering his hypertension, it is crucial to monitor and you are given a -2 and adjust medications to prevent adverse effects on renal function. The given options are A. Ibuprofen and blood glucose levels. B is acetaminophen and respiratory rate. C. Naproxen and renal function. I'll give you some time to think about the answer. If you're watching this video and feeling the pressure of tackling those challenging NCLEX-RN case studies, you're not alone. But what if I told you that the strategies and tips we're discussing here are all pulled straight from a game-changing resource designed to take your exam prep to the next level? Actually, the strategies for the case studies in this video is taken from NCLEX-RN Case Studies Exam Practice Bootcamp. This book is packed with over 100 in-depth case study questions, each carefully crafted to bridge the gap between theory and real-world clinical practice. Whether you're dealing with anxiety or feeling unsure about the complexities of case studies, this book is the perfect way to transform fear into confidence. With a focus on first attempt success, this bootcamp will not only teach you the right answers, but also guide you through why other options don't make the cut, so you can learn from each mistake and grow stronger with every case. The author has helped countless students just like you conquer their NCLEX on the first try, and now you can benefit from their expertise too. So, if you're ready to boost your confidence, master those case studies, and head into your NCLEX exam prepared like never before, the NCLEX-RN Case Studies Exam Practice Bootcamp is your trusted companion. You can find it right now. The link of the book is given in the description below. The correct answer are C, naproxen and renal function. The patient experiencing joint pain due to arthritis may be prescribed NSAIDs such as naproxen for pain management. Considering his hypertension, monitoring renal function is crucial due to the potential adverse effects of NSAIDs on the kidneys. The incorrect options are A, ibuprofen and blood glucose levels. While ibuprofen is an NSAID commonly used for pain, monitoring blood glucose levels is not directly related to its use. Renal function is more relevant in this context. Option B shows acetaminophen and respiratory rate. Acetaminophen is not an NSAID and is less likely to affect renal function. Respiratory rate monitoring is not directly related to arthritis medication. This question assesses the understanding of appropriate arthritis medication choices and the importance of monitoring specific parameters, especially in the context of hypertension. The question is the fill-in-the-blanks type question. Note that in NCLEX exam, you will encounter some of the filling up the blank spaces or choosing right word or words that matches the context of the question. Your question is given like this with a blank space to fill in. When managing an elderly patient with arthritis, it is essential to assess dash. Please fill the blank here, as these medications may impact renal function. Additionally, regular monitoring of dash is crucial, especially considering the patient's history of hypertension. Please fill up these two dashes. The options given to you are Option A, cognitive function and blood pressure. Option B, joint mobility and blood glucose levels. Option C, renal function and vital signs. I will give you some time to check the answer. All right, the correct answer is Option C, renal function followed by vital signs. Arthritis medications, especially NSAIDs, can potentially impact renal function. Monitoring renal function is crucial to prevent adverse effects. Additionally, regular vital sign monitoring, including blood pressure, is essential, especially in patients with a history of hypertension. Other options are incorrect. Option A is incorrect because, while cognitive function is important, the primary concern related to arthritis medications in this case is renal function. Blood pressure monitoring is also crucial but not directly related to arthritis medications. Option B, joint mobility, blood glucose levels, is also incorrect. Joint mobility is a concern in arthritis management, but the question emphasizes the impact of medications on renal function. Blood glucose levels are not directly related to arthritis medications. This question evaluates knowledge related to monitoring parameters when managing arthritis medications in an elderly patient with hypertension. Let us see the next question. Which of the following side effects should the nurse be particularly vigilant for in this case? You have to select two options. The options given to you are A, gastrointestinal bleeding, B, Increased blood glucose levels. C. Renal impairment. D. Cough. E. Cognitive decline. Option F. Enhanced joint mobility. I'll give you some time to think about the answer. Correct answers are A. Gastrointestinal bleeding and C. Renal impairment. For option A, NSAIDs, commonly prescribed for arthritis, can increase the risk of gastrointestinal bleeding. Monitoring for symptoms such as black stools or abdominal pain is crucial. For option C, renal impairment, NSAIDs, including those used for arthritis, may impact renal function. Regular monitoring of renal function is essential to detect any signs of impairment, such as changes in BUN and serum creatinine levels. Incorrect options. Is the incorrect option. Arthritis medications, particularly NSAIDs, are not known to significantly affect blood glucose levels. This side effect is less relevant in this context. Option D, or cough, is also incorrect. Cough is a potential side effect of medications like ACE inhibitors, commonly used for hypertension. However, it is not directly related to arthritis medications in this case. Option E, or cognitive decline, is also incorrect. While cognitive decline may be a concern in elderly patients, it is not a common side effect of arthritis medications. This option is less relevant in the context of Mr. Johnson's case. Option F, or enhanced joint mobility, is also incorrect. Enhanced joint mobility is a desired outcome of arthritis management. It is not a side effect but a positive effect of appropriate treatment. This option is incorrect in the context of potential side effects. Let's see another question. A nurse is preparing to administer medication to a patient with a history of severe allergic reactions. The medication prescribed is penicillin, which the patient has not received before. The nurse has already obtained the medication from the pharmacy and is now reviewing the steps for medication administration. Which of the following statements made by the nurse is correct? Your options are: Option A, the nurse should administer the medication as quickly as possible to ensure it takes effect. B, the nurse should not administer the medication to the patient due to the risk of an allergic reaction. C, the nurse should closely monitor the patient for any signs of an allergic reaction after administering the medication. And the last option is D, the nurse does not need to obtain informed consent from the patient since the medication is not a high-risk drug. Please take your time to go through the question once again. The correct answer is C, or the nurse should closely monitor the patient for any signs of an allergic reaction after administering the medication. Option A, which states the nurse should not rush to administer the medication as quickly as possible, is not correct. Instead, the nurse should take time to review the medication order, verify the patient's identity, and check the medication for accuracy and expiration date. Rushing through the medication administration process can lead to errors and adverse events. For option B, while it is true that the patient has a history of severe allergic reactions, the nurse should not automatically withhold medication based on this information. Instead, the nurse should assess the patient's current condition and consider any potential benefits and risks of administering the medication. If the medication is deemed necessary, the nurse should closely monitor the patient for any adverse reactions. Option C. This statement is correct. Since the patient has a history of severe allergic reactions and is receiving a medication to which they have not been exposed before, the nurse should closely monitor the patient for any signs of an allergic reaction. The nurse should remain with the patient for at least 30 minutes after administering the medication to observe for any adverse effects. Option D. This statement is incorrect. Even though penicillin is not considered a high-risk drug, informed consent is still required before administering any medication. The nurse should explain the purpose, potential risks, benefits, and alternatives to the medication to the patient or their legal guardian before obtaining informed consent. Let us go through another question. A nurse is preparing a client for surgery and must obtain informed consent. Review nutrition guidelines, address elimination needs, clean the surgical site, and provide preoperative teaching. Which of the following statements from the patient indicates that they understand the surgical procedure and have given informed consent? Your options are: Option A, I signed the consent form, but I'm not sure what the surgery is for. Option B, the nurse explained the surgery to me and I understand what it involves. Option C, I don't want to have the surgery, but my family is making me do it. Option D, I didn't sign anything yet, but the surgeon told me I need this surgery. The correct answer is option B, or the nurse explained the surgery to me, and I understand what it involves. Informed consent is a process in which the client has been provided with information regarding the risks and benefits of the procedure, as well as any alternative options. The client must understand this information and be able to make a voluntary decision to proceed with the procedure. Therefore, the correct statement is B, indicating that the patient understands the surgery and has given informed consent. Hey, if you're looking for a solid resource to practice questions and answers as you get ready for the NCLEX, I've got a recommendation that might really help you out. I recently found the next-gen NCLEX-RN Practice Question Bank, Big Book of Question-Answer Practice, and it was super helpful for preparation of this video as well. If you're trying to get comfortable with the new next-generation NCLEX format, this book is definitely worth checking out. It's got daily practice questions that are designed to reflect what you'll see on the exam, which is awesome because it gets you into the right mindset. Plus, after each question, you get detailed explanations so you'll not only know the right answer but understand why it's right and why the other options are wrong. That really helps you build your critical thinking, which is key for the NCLEX. I also love that it includes study tips and strategies specifically tailored for the NGN format. And if you're like me and need a little motivation, it has success stories and insights from other nurses, which really keep you inspired throughout your prep. If you're looking to practice and build confidence, this could be a great resource to add to your study routine. It's structured so you can stay on track and focus on mastering the material step by step. Just thought I'd share in case you're looking for something to really help with those practice questions. You've got this. Let's see another question. Mr. Smith, a 65-year-old male, presents to the emergency department with complaints of fever, productive cough with greenish sputum, chest pain, and shortness of breath for the past 3 days. He reports a history of smoking and occasional alcohol consumption. On examination, he appears lethargic with increased respiratory rate and decreased breath sounds on the right lower lobe of the lung. Chest X-ray reveals consolidation in the right lower lobe consistent with pneumonia. Which of the following statements of the patient is consistent with the diagnosis of pneumonia? A. I have been experiencing a dry cough for the past few days. B. My sputum is yellowish in color. C. I have not experienced any fever or chest pain. D. I have a history of smoking. E. I have not been feeling short of breath. F. I have been experiencing nausea and vomiting. I'll give you some time to go through the question and each of the options. You can pause the video as well if you need more time. All right, let me explain the answers to you. B. My sputum is yellowish in color. This statement is consistent with pneumonia, as greenish or yellowish sputum is a common symptom due to the presence of pus in the airways. D. I have a history of smoking. A history of smoking increases the risk of developing pneumonia as it weakens the immune system and damages the respiratory tract, making individuals more susceptible to infections. Options A, C, E, and F are incorrect. Option A. I have been experiencing a dry cough for the past few days. While cough is a common symptom of pneumonia, a productive cough with greenish sputum is more indicative of pneumonia than a dry cough. Option C. I have not experienced any fever or chest pain. Fever and chest pain are common symptoms of pneumonia. The absence of these symptoms makes this statement inconsistent with the diagnosis. Option E. I have not been feeling short of breath. Shortness of breath is a common symptom of pneumonia due to the inflammation and infection in the lungs. The presence of shortness of breath is more indicative of pneumonia. Option F. I have been experiencing nausea and vomiting. Nausea and vomiting are not typical symptoms of pneumonia. These symptoms may suggest other conditions such as gastrointestinal issues. Let's see another question. Emma is a 9-year-old girl who always tries to please her parents and teachers. She is very concerned about being a good girl and following the rules. Emma is currently in which stage of moral development according to Kohlberg's theory? The options given for this question are shown on the screen. Option A, stage 0, egocentric judgment. Option B, stage 1, punishment obedience orientation. Option C, stage 3, good boy or nice girl orientation. Option D, stage 4, law and order orientation. Take some time to go through the question and options carefully. You can see the timer running at the top right of the screen, but if you need more time, you can pause the video as well. All right, let me reveal the right answer. The correct answer is option C. Stage 3. Good boy or nice girl orientation. According to Kohlberg's theory, Emma's concern for being good and following the rules indicates that she is in the third stage of moral development, which is the good boy or nice girl orientation stage. This stage involves conformity to avoid disapproval or dislike by others, and individuals in this stage interpret being good as having good motives and showing concern for others. Emma's desire to please her parents and teachers is consistent with this stage. Option A, Stage 0, egocentric judgment, is incorrect as this stage describes the earliest stage of moral development where the child has no awareness of right or wrong. Option B, Stage 1, punishment obedience orientation, is incorrect as this stage involves making judgments based on avoiding punishment or obtaining a reward, and the child obeys rules to avoid punishment or to avoid displeasing those in power. Option D, Stage 4, law and order orientation, is incorrect as this stage involves a greater concern for society as a whole, and the emphasis is on obeying laws to maintain social order, which is not consistent with Emma's behavior. I think that one was easy. Let us solve other problems for more practice. A 4-month-old baby girl is brought to the pediatrician for a routine checkup. The doctor observes that the baby is grasping and switching objects from one hand to the other. Which of the following statements from the parents indicates that the baby is developing normally? The options given for this question are shown on the screen. Option A, she doesn't seem to recognize us yet, even though we're her parents. Option B, she cries a lot, especially when we put her down to sleep. Option C, she hasn't rolled over yet, but she seems to be trying. Option D, she loves it when we play with her and smile at her. Take some time to go through the question and options carefully. You can see the timer running at the top right of the screen, but if you need more time, you can pause the video as well. All right, let me reveal the right answer. The correct answer is option D. She loves it when we play with her and smile at her. At 4 to 5 months, infants should be grasping and switching objects from one hand to the other, as well as showing enjoyment of social interaction. Option A is incorrect because at this age, infants should recognize and respond to their parents. Option B is incorrect because although infants may cry frequently, crying when put down to sleep specifically is not a developmental milestone. Option C is incorrect because rolling over is a milestone for 4 to 5 months, not a requirement for normal development at 4 months. Option D is correct because enjoyment of social interaction is a milestone for 4 to 5 months, and playing and smiling with the baby is a good indicator that she is meeting this milestone. Mrs. Bimmel, a 64-year-old female, has just undergone a craniotomy for a brain tumor. As the nurse responsible for her care, you are tasked with monitoring her postoperative status closely. You check on her every 30 to 60 minutes, monitor her vital signs, and assess her neurological status. You also check her head dressing frequently for signs of drainage and record the amount and color of any drainage from the drain every 8 hours. Which of the following statements from the nurse indicates that she is providing appropriate nursing care following a craniotomy? The options given for this question on the screen are: Option A, I will monitor the head dressing for signs of drainage every 4 hours. Option B, I will measure the amount and color of drainage from the drain every 12 hours. Option C, I will maintain fluid restriction at 2,500 ml/day. Option D, I will administer sedatives to promote sleep. Option E, I will provide range of motion exercises every 12 hours. Option F, I will monitor for dysrhythmias resulting from respiratory distress. Option G, I will notify the HCP immediately of excessive amounts of drainage or a saturated head dressing. Take some time to go through the options. The time is on the top right side of the screen, but you can always press on the pause button if you want more time. Correct answer, G and A. Option A is correct because monitoring the head dressing for signs of drainage is crucial to detect any possible complications, such as infection. Checking every 4 hours would not be frequent enough to catch any changes in a timely manner. Option G is also correct because notifying the HCP immediately of excessive amounts of drainage or a saturated head dressing is essential to prevent further complications. Option B is incorrect because measuring the amount and color of drainage from the drain every 12 hours is not frequent enough to detect any changes in a timely manner. Option C is incorrect because fluid restriction should be maintained at 1500 ml/day, not 2500 ml/day. Option D is incorrect because administering sedatives is not indicated following a craniotomy. Option E is incorrect because range of motion exercises should be provided every 8 hours, not every 12 hours. Option F is incorrect because dysrhythmias resulting from respiratory distress are not commonly associated with a craniotomy. They may be caused by fluid or electrolyte imbalance. Which of the following statements said by the patient indicates that they may be experiencing Bell's palsy? The options given for this question on the screen are: Option A, I have been experiencing a gradual progressive weakness of my lower extremities and facial muscles. Option B, I have been having paresthesias and hypersensitivity to touch. Option C, I have been experiencing pain in my upper body and have an abnormal electroencephalogram. Option D, I have been having difficulty breathing and my respiratory status is being closely monitored. Option E, I have an elevated protein level in my CSF. Option F, I am experiencing weakness and paralysis on one side of my face. Option G, I am having difficulty chewing and have lost taste sensation. Take some time to go through the options. The time is on the top right side of the screen, but you can always press on the pause button if you want more time. The correct options are F and G. Bell's palsy is characterized by paralysis of one side of the face, as well as loss of taste. Option A describes weakness of lower extremities, which is not characteristic of Bell's palsy. Option B describes paresthesias and hypersensitivity to touch, which may be indicative of Guillain-Barré syndrome. Option C describes pain and an abnormal electroencephalogram, which may be indicative of other neurological conditions. Option D describes difficulty breathing, which is a major concern in Guillain-Barré syndrome. Option E describes an elevated protein level in the CSF, which may be indicative of various neurological conditions. Therefore, options F and G are the correct answers as they are the only statements that describe symptoms characteristic of Bell's palsy. By the way, the strategies we've been talking about in this video, those approaches for tackling tricky NCLEX questions, and managing the different types of questions are actually taken straight from a resource I really recommend: the new NCLEX-RN Practice Question Bank. If you're looking for a great way to practice and apply those strategies, this book has over 700 questions that mimic the real exam format, and each one comes with detailed explanations that help you understand exactly why the correct answer is right and why the others aren't. It's a great way to reinforce the strategies we've been covering here today. This book is especially useful if you're struggling with the new next generation NCLEX format or just need a structured way to build up your confidence with daily practice. You'll find it's all about practicing smart, not just hard, and really honing your test-taking skills. So, if these strategies are helping you out, this book could be a solid next step to boost your preparation even further. Just thought I'd share that in case it's something you want to check out. You've got this.